Hi, it's Professor Kristen, and one of the things that I really wanted to do to help people during this COVID-19 crisis is to create a series of videos for home first aid. And so my first video will be bee stings and bug bites. So let's get started. Removing the stinger immediately is the first thing you need to do, because the longer it's in, more poison or venom will go into the tissue. So what you want to do is get a hard something, like a driver's license is what I have, or a credit card, or even a knife, and you want to scrape away from where the stinger, if the stinger went in this direction, we're going to go this direction to pull it out. Do not use tweezers, because you can rupture or squeeze more venom into it by using this method. Secondly, once the stinger is removed, wash the area with soap and water. And then you can apply ice. And if you do apply ice to the area, never put ice directly on the skin. I have a baggie that I can put ice in. I can fold it, and I would wrap it in my washcloth to put directly onto the bug bite. If you're applying an ice pack or a cold pack onto the site, leave it on for 10 minutes, never with ice directly to the skin, because it will damage the skin and the tissue, but with a cloth wrapped around like I showed you, or 10 minutes on and 10 minutes off, or as long as the patient or person or family member can tolerate, but no longer than 10 minutes. On 10 minutes, off 10 minutes. If you believe that you've been bitten by a brown recluse spider or a black widow spider, please seek emergency help immediately. This will definitely take a medical intervention. Call 911. So, we removed the stinger, we've washed the area with soap and water, and we've applied our cold compress or ice pack, not with direct ice to the skin. 10 minutes on, 10 minutes off. Then there are other things we can do to help the area feel better. One, we can use an anti-itch spray, a type of lidocaine numbing solution to spray directly on. That will help with the discomfort. We can use apple cider vinegar. You can soak the actual area for about 15 minutes to neutralize the venom. And if not soaking, you can actually put the apple cider vinegar on a bandage or a cloth and put it directly onto the bug bite. Actually, you can use meat tenderizer also. And what you do is mix a meat tenderizer water paste and apply it directly to the bug bite. They say that it will help with pain and discomfort and itching. The other thing we can do, and most everybody has this in their home, is a baking soda water paste. You make the baking soda water, make a paste, and put it directly on the bite. It will help neutralize the area, which helps with the itching, discomfort, and pain. There's some other things at home that you can actually use to help with some of the discomfort and help the wound or the bug bite to heal and not hurt or itch as badly. Aloe vera is a choice, lavender oil, tea tree oil, and witch hazel are all also good sources that you can access and use at home. Not everybody reacts the same to bee stings, wasp stings, or bug bites. So if there's anybody that has swelling or feels like their throat is closing in, please call 911 immediately and seek out emergency services. Just FYI, emergency services are prepared to help treat on site. But while waiting for emergency services, go ahead and loosen up the clothes of the individual that's having trouble. Lay them on their side. And if needed, start CPR immediately. Please, I am not a physician. I'm just here to give you some helpful hints at home. An ounce of prevention is worth a pound of cure. So one of the things to think about is, how can I prevent being stung? Be aware of your surroundings. Don't wear really bright clothes that attract bees and wasps. And don't wear those perfumed lotions and scents that are very attractive. Hi, if you enjoyed my video, please subscribe to my channel, Professor Kristen, and look for the next videos to come out for my first aid at home during the COVID crisis. Thank you. Bye. Please, if you have any difficulties in breathing, hives, or any other medical emergency, please seek help. Also, continue to monitor for signs and symptoms of infection at the site of the bite.